Operations Planning and Logistics Lead for the Vaccine Implementation Task Force. As of today, more than 46% of people aged 18 or older have received at least one dose, and we've administered more than 591,000 doses, so almost 600,000 doses. Today, we expect to give more than 13,400 doses at sites throughout the province, and we will completely exhaust the vaccine supply we have on hand right now in about a week. As more vaccine arrives in our province, that means our operations are also accelerating in response. This week, we'll give more than 84,000 doses in super sites, pop-up clinics, urban indigenous clinics, and through our focused immunization teams. Next week, we expect to continue on with this pace, and the week after that to further increase this pace as a Moderna shipment arrives to support our weekly Pfizer shipments. We are well on our way to having Manitobans vaccinated with their first dose by early June, and to having Manitobans begin booking their second dose appointments no later than May 22nd. The Lila Super Site opened on the 7th, Dauphin opened on Monday, Steinbach opens next week, and Gimli will open its doors on the 29th. You can book appointments now at all of our super sites, at pop-ups that are running next week as well throughout the province, or at an urban indigenous clinic. And as more people are using our super sites, I want to talk a little bit about how we're moving people through them, especially our complex and large sites. We know we hit some growing pains at RBC at the end of March. At that point, wait times averaged 35 minutes between the first and the third floors. However, we do know it was much higher for some people. That was not the experience we wanted people to have. However, since then, we have seen significant change. We're measuring wait times on both floors of the RBC site and at the Lila site every 2 hours, 7 days a week. For more than a month, we have seen people consistently get in on time or before their appointment time. Right now, at RBC, people's appointments are taking between 25 to 40 minutes from beginning to end, including the 15 minutes required for post-immunization observation. To help keep your times lower, please be sure to download, print, and fill out your consent form ahead of time if you're able to. We have also been getting questions from families affected by the shift to remote learning. People have asked what that means if they have a vaccine appointment. You can line up, if you can line up childcare for your immunization time, then that's great, but don't let that be a barrier to getting vaccinated. We want you to be able to get your vaccine. So if you don't have childcare, you're welcome to bring your kids with you to a super site or to a pop-up. Just remember, of course, that you will need to wear a mask and practice good physical distancing. And with that, I will pass it over to Dr. Reimer.
Thank you. Good afternoon. I'm Dr. Joss Reimer, Medical Lead for the Vaccine Implementation Task Force. With vaccine supplies expanding, as Johanu has mentioned, we are pleased to announce the eligibility continuing to expand for this vaccine. As of today, all Manitobans aged 18 and over can now make an appointment for their vaccine. So please help spread the word in your community so that people know that they can book a vaccine appointment. À compter d'aujourd'hui, la vaccination est ouverte à tous les Manitobans âgés de 18 ans et plus. Je vous invite à passer le mot autour de vous pour que les gens sachent qu'ils peuvent prendre rendez-vous pour se faire vacciner. Our plan was for all adults in Manitoba to be eligible to book an appointment by May 21st. Our teams have been working very hard to meet that target, and today we have exceeded it. This is what we've been waiting for. This is what we've been looking forward to announcing for quite some time. The opportunity for all adults in Manitoba to protect ourselves and protect each other. C'est l'occasion que nous attendions tous, celle de nous protéger les uns les autres contre le virus. And if you are newly eligible today, or because of our eligibility expansions earlier this week, there are appointments available for you to book right now. There are thousands of appointments at the Lila Super Site next week in Winnipeg. The Lila Super Site will have the Moderna vaccine, and that is the earliest opportunity to get immunized within the city. We are still planning to make the Pfizer vaccine available to those who are aged 12 and over based on the new authorization from Health Canada. I expect to be able to provide more information on that soon. Today, Manitoba is also adjusting its approach to AstraZeneca or Covishield vaccines in response to ongoing evidence and some supply chain issues. We need to respond to the disruptions in supply so that the many thousands of people who have already had their first dose of AstraZeneca can be confident that we will have a second dose available for them when they get to that point. As a result, the AstraZeneca that is still in the province now and the doses that will be delivered to us in the future will be held for second dose immunizations only. We do recognize that we have to build in some flexibility here. So there may be a very small number of first doses that are still given in situations where people may not otherwise be able to be immunized at other sites. There may be people who face a barrier in getting to a super site, perhaps transportation, childcare, or other systemic barriers, or even just being afraid of such a big space that is unknown, but may feel comfortable going to their pharmacy down the street that has AstraZeneca. And if that person fits the AstraZeneca criteria, the benefits of being vaccinated still significantly outweigh the risks of not being immunized at all. So overall, our approach is to reserve these doses that already are in the system, as well as the future ones, for second doses, but recognizing that a small number might still need to be used for first doses on a case-by-case basis. We are also closely monitoring decisions on whether different types of vaccines can be used to administer second doses, and that will help guide our approach in the future. We know that there are some research studies that should be providing us with some evidence later this month, and that will help us finalize our plan for dose 2. But I want to reassure Manitobans that anyone who received the AstraZeneca vaccine for their first dose will receive a second dose either of AstraZeneca or of one of the mRNA vaccines. I want to emphasize that while we are shifting our approach, it will have no effect on our plans to get a first dose of vaccine to everyone aged 18 and up by June 8th. And I know it feels like a lot has been changing around the AstraZeneca vaccine, and that's because it has. And we feel that way as well. I want to keep you informed, but with all of this information, I want to make one thing very clear. Over the last 2 months, when we have been giving AstraZeneca, it has protected many tens of thousands of Manitobans who would not otherwise have had that protection. If you got the AstraZeneca vaccine as soon as you were eligible, and I know a lot of people in the 40 and up age category did that, you did the right thing. You provided yourself and your families with protection as early as you possibly could. So we thank you for following the public health guidance, for protecting yourself, and for protecting the people around you, even as we change our approach now that our mRNA vaccines are much more robust in supply. Earlier this week, the Protect Our People MB campaign launched. And this is one part of how we want to make the vaccine more accessible and more inclusive. This project uses influencers and social media to connect with First Nations people aged 18 to 35 about vaccines, to build confidence and encourage them to be immunized. It is a compelling and authentic campaign, and we are proud to support this work. We also want people to feel welcome and safe when they are immunized, and to reduce some of those barriers. One way that that is happening is through a broader partnership with First Nations leadership on the vaccine campaign overall. We have also supported 5 urban Indigenous clinics. Now, we are also working with the Southern Chiefs Organization and MKO to help ensure that our vaccine sites are more reflective of the populations we're serving. They are helping to connect vaccine sites with cultural liaisons and others to help make the sites feel more welcoming and culturally safe. They will welcome First Nation, Métis, and Inuit individuals to vaccination sites, provide translation where possible, help people fill out consent forms, and provide overall support. There will also be Indigenous outreach and support workers who will work with community organizations to distribute information on the vaccine, to encourage people to get their first dose, and to follow up with information on second doses, and even to help arrange for transportation if needed. SCO and MKO are leading the recruitment process for these positions, which we believe will help reduce discrimination and ensure that people feel safe. This is very good news, and I want to again thank SCO and MKO for leading this work. We know we still have a long way to go, but we're really proud to be working with these partners and the work that's going on so far. People in Manitoba who are transgender also let us know that the way we were asking for self-identification of gender on our consent forms was wrong, inappropriate, and disrespectful. We should have done better before, and we need to do better going forward. So I want to apologize for our error on the consent form. Les personnes transgenres du Manitoba nous ont informé que la façon dont nous leur demandons comment elles s'identifiaient sur notre formulaire de consentement était erronée, inappropriée et irrespectueuse. Nous aurions dû faire mieux et nous ferons mieux à l'avenir. Je vous présente mes excuses pour notre erreur. We are updating our consent form for immunization to include more appropriate gender options. That will become available soon. We want our sites to be inclusive and welcoming for transgender people and people who identify any gender at our sites. If your name or your gender identity doesn't match what's on your ID or on your health card, that is not a barrier for you to be immunized. When it is your turn, we want you to be vaccinated, and we want you to feel safe and respected when it's your turn. Thousands of people are being immunized every day, and we want you to be one of them. Today, we are also announcing who will be able to book their second appointments first, starting no later than May 22nd. So the first group who will be eligible to book a second dose will be people with specific medical conditions that put them at risk of not having a sufficient immune response after their first dose. A complete list and more information will be available online today, but it will include people who are on dialysis, people who have Down syndrome, people who have received or are on the list to receive an organ transplant, people who are actively receiving chemotherapy for cancer, and those living with HIV. Again, these are some of the examples, and the complete list will be available online. We are in a race against the virus, against the variants, and we are seeing the devastating effects it can have on people, on our healthcare system, and on our healthcare providers. The third wave is here, and we need to take a seat in the vaccination clinic, roll up our sleeves, and protect ourselves and each other. I know that the introduction of new public health orders and the move to remote learning in schools in Winnipeg and Brandon was disheartening. But getting the vaccine is something that we can all do to help bring the case numbers down. So please, I ask all of you, now that all adults in Manitoba are eligible, call today and make your appointment. And with that, we can go to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Free Press, Danielle.
Hi, and good afternoon. Dr. Reimer, how much interest did you see from prioritized communities for appointments and vaccine uptake, and did it meet your expectations?
I think overall we've been really encouraged to see how much uptake there's been from Manitobans, particularly the cohorts that have been eligible the longest. Our uptake in those who are over 80 is over 90%, and that's exactly what we were hoping to see, that those individuals who were at the highest risk of severe outcomes related to COVID would be protecting themselves as soon as possible. Regarding younger cohorts, we've just started to open that up, so it's too early for us to say what the uptake is in these groups, but we are certainly optimistic that we will see high levels of uptake in these groups as well, and we will be watching it carefully, and I look forward to being able to report on the numbers as we go forward.
Okay, thank you. And with respect to the hotspot communities, have you received any early data from those areas about vaccine uptake? And can you comment on all about how uptake in those areas might impact the length and severity of the third wave?
So we did see an increase in uptake in those areas after making them eligible. I don't have the exact numbers in front of me, but I did discuss with one of our epidemiologists who told me that they did see a very clearly measurable increase in uptake in the priority communities, which was wonderful to see. We do know that those priority communities are also the ones that face a lot of barriers to getting vaccine, and eligibility was just one of those barriers. And so we're going to, as we move forward, continue to try to reduce barriers for people in every way that we can. Right now, our focus has really been on the speed of the rollout and getting doses into arms as quickly as possible. But I know our operations team is actively working on a number of different options as we move forward to be able to reduce barriers for people. I don't know if, Johanna, you want to comment at all?
I think that covers it really well. Thanks, Dr. Reimer.
From Global News, Marnie.
Hi, I'm just wondering, with holding these AstraZeneca shots for second doses, what's holding us back from letting people, AstraZeneca recipients who had that shot as their first dose, start booking second doses now?
Well, we're not booking any second doses at this point. So that would be the main issue that would prevent someone from who received AstraZeneca from booking a second dose appointment, regardless of the vaccine that they would be booking for. When we're talking about AstraZeneca specifically, the trials that the manufacturer did showed better efficacy when they waited more than 12 weeks to administer the second dose. So that longer time period in between dose 1 and dose 2 was actually beneficial to the participants in the trial in their ability to protect themselves against the virus. And so while there may be some case-by-case exceptions, our advice right now to physicians and pharmacists is to book the second dose no earlier than 12 weeks after the first dose in order to ensure that we give everybody the best possible immune response that they could have. Now, we are waiting on data about the possibility of mixing vaccines and offering mRNA to those who received AstraZeneca. The trial that we're waiting on has told us that they're expecting results in May, but we don't know exactly when those will be coming. And so, if at all possible, we'd like to wait for the best possible science that is available. But certainly our clinical team, if we need to make decisions before that trial comes out, is prepared to do so and is working through evidence from other vaccines and what we know about immune responses more generally to inform that decision should we have to make it before that trial completes.
Okay, thank you for that. And we had the Prime Minister called this a one-dose summer, and premiers have said it will be 2 doses. When we start our second dose or booking second doses at the end of the month, just kind of what pace do you anticipate the rollout of second doses being like in Manitoba?
Yeah, thank you for that. No, it'll be a 2-dose summer in Manitoba. We will get through our second dose campaign by end of July. That's what we're looking at. And that's based on being able to start booking our second dose appointments no later than May 22nd, and then going through those cohorts based on the health conditions that Dr. Reimer had mentioned, and then on when individuals received their first dose. So we're quite confident that we'll kick this off, the second dose campaign, with first doses in arms early mid-June, and then everyone done who would like one mid-end July.
From the Brandon Sun, Colin.
Good afternoon. Dr. Reimer, with eligibility having increased so much over the past few weeks, can you give us some insights into what uptake is like in various age groups and generations? Who's wanting the vaccine most at this point?
So we're very early on to be able to say much about uptake in younger populations because they just became eligible. So most of them are either just starting to receive their dose or are booked but haven't yet received their first dose. So I can't comment too much on what uptake is like in those younger populations because we just haven't given them enough time to book. Certainly, we were able to open up faster than we had originally predicted. And part of that is due to the fact that many younger people were already eligible through other mechanisms, either where they lived or what job they work in. So that is one of the things that allowed us to be quite quick. But we need to keep a close eye on the booking and the uptake as well to ensure that we're not seeing any decreased uptake in younger populations. So yeah, I think it's too early for me to say much about the younger populations right now, but that is something we're going to watch very carefully and try to reach out as soon as we see any sort of pattern emerging, try to reach out to those age cohorts where uptake is less. But for the groups that have been eligible for longer periods of time, the uptake has been excellent. And so we are certainly remaining optimistic that we'll see high uptake in all age groups once we give them a bit of time to make those appointments.
I was also wondering if either of you might be able to tell us how popular uptake has been in the Brandon downtown and Brandon East End communities, neighborhoods that were added to the list of eligible communities in recent weeks.
I can speak to the booking rate, which is very healthy and robust at Keystone or at the Brandon super site. People are booking out, depending on when we release a cohort, between 2 to 3 weeks out, which means that people go and fill up appointments in Brandon. And that's been similar with the pop-ups that we do in the Prairie Mountain region. They fill up and they're popular. So that's it from a booking perspective. Thus far, the demand is there when we've opened up appointments, but specifically around what uptake might be, not Brandon writ large, but the hot spots there, so to speak. I think Dr. Reimer, you'll have to weigh in if there's any data yet on that. I don't have anything on that.
Yeah, we do track uptake by health district. I don't have the full list of health districts in front of me right now. And I know that our communications team was working on how best to share that information with Manitobans. So I'll have to take that question back to them to see what sort of information they could share and in what format.
From CJOB, Skylar.
Hi, thanks for your time this afternoon, you two. Johanna, you spoke about accelerating the rollout of the second dose. Obviously, it's looking like it's going to be a lot quicker than the first dose campaign, but when we get to a certain point where there's more vaccines than people that need to be immunized in this province, it sounds like things could really be expanded in terms of hours of operation, and we could really put the pedal down to get to that finish line. Can you just explain that once again for us?
Sure. So, I mean, that's reflected in the timelines that we've already been projecting. So the fact that we are looking at a second dose campaign that will last from a month and a half to sort of max on the outer edges 2 months reflects both the supply projections from the federal government and us being able to, via super sites, pump out what we get each week within the week. Focused immunization teams, of course, moving a bit slower through congregate living facilities. But even our pop-ups now we're moving towards being able to do that in about a week. So that time frame crunch, if you will, includes the supply that we're projected to get throughout the second quarter and our corresponding capacity ready to pump it out, within each week. And that's why you look at the first dose campaign, and we started this mid-December, and it's almost early summer now, and we'll get through our first dose campaign. That's really a reflection on supply. That supply is a very different picture now, starting the second dose campaign, and hence why we can fit it into that month and a half time frame approximately.
Thank you for that. I think this might be more your perspective as well. Can you give us a sense of how many appointments are going unfilled day to day, for a variety of factors? I've seen several instances, where friends of mine have been able to find an appointment several days sooner than they may have. But how many of those open slots aren't going used at the end of the day?
So I would suggest that if the main reason why appointments are open sooner is because of our pop-up scheduling. So if we have, for instance, 1680 Notre Dame as our large Winnipeg pop-up, when there's Moderna that arrives and we can sort of overflow into there, you'll see appointments open up there quickly within a couple of days. And I think that's the larger numbers as opposed to appointments going unfilled in super sites. If we compare the data of appointments booked versus how many were actually administered at a super site, the amount of no-shows, so to speak, is incredibly low. So I'd have to go get the percentage for you and get that data point. But we don't see a massive discrepancy between appointments and doses in arms per day per site. And as you know, most sites are booking between 1 week to 3 weeks out. So most of the doses coming in have been earmarked, so to speak. They have a name attached to them, and so we don't, we're not seeing empty appointments at all yet. People are going. People are booking up.
From the Winnipeg Sun, Scott.
Good afternoon to both of you guys. Just curious. In terms of the 12 to 17, Dr. Reimer, I know Johanu kind of deferred these questions to you during the technical briefing this morning. So where are we at in terms of getting, kind of maybe a firmer timeline on when ages 12 to 17 will become eligible?
Well, the main issue related to the timeline at this point is actually supply and appointments being available. So really, we will open up to age 12 and above as soon as our booking team tells us that we have appointments available to book. So we have worked with our clinical team to ensure that the consent process has been finalized. It went through our legal services as well to make sure that it was consistent with everything that we do in the healthcare system. And that's all in place, and we're just right now orienting our staff to some of the changes when it comes to providing a service to a minor. So from the clinical side, there's nothing holding us back from opening up. It's really coming down to a supply issue. So maybe, Johanu, I don't know if you want to comment.
Yeah, thanks, Dr. Reimer. It's, in terms of the experience at the sites, it'll be nice to see younger faces there, and there is a bit of a clinical adjustment in terms of the consent process. But for planning and operations, it's just another cohort or just another group of people. But it's not an insignificant amount. It's 100,000 just under Manitobans. So we've dropped 12 years over the last 2 days. Appointments are filling up fast. Our call center is humming. And as with every other drop, we monitor and we watch before we open up appointments again to the next group. This will be the last group, likely, unless there's surprising clinical guidance on anything below 12 plus, but this will be the last group that we open up to. And we want to make sure we do that right and they have a smooth experience, and at the moment we open up to them, they can all make an appointment in the region in which they reside.
Great, thanks for that. And just going back to kind of last week, I know there was talk potentially of maybe prioritizing some groups of children, maybe based on health conditions or that. Has that been, looked at, or will it just be a straight drop from 18 to 12?
Yeah, so when it came to prioritization, we were in a different position now than we were when we originally had to make a lot of those difficult decisions around which groups to prioritize first. With the number of doses that are coming in, we're going to be able to open up to all Manitobans 12 and over by the dates that we had announced previously. So even if we were to prioritize certain health conditions, we'd be talking about, giving them 1 day, maybe 2 days advanced booking compared to the rest of the cohort. So for simplicity for Manitobans to be clear about when they can book, we're just going to stick with the age-based approach, recognizing that this is going to be occurring very quickly.
Great, thank you.
From CBC Radio Canada, Julian.
Good afternoon. My question would be about the fact that we now opening the vaccination for all adults, and I'm wondering what's the point of still using AstraZeneca when almost everybody can have Pfizer or Moderna vaccine now?
So we did announce today that for the most part our strategy is shifting on AstraZeneca, and we will be holding back on most of the doses that we have now and all of the doses that come in shipments in the future for second doses. We don't have a confirmed supply coming in for AstraZeneca, largely due to the export ban that remains in India. And so we wanted to start reserving these doses as soon as possible to ensure we had them available for Manitobans who received their first dose of AstraZeneca. That said, there may be a small number of people who, for a variety of reasons, might not get vaccinated unless they're offered AstraZeneca. And so we still feel that for those who are over 40 or are in their 30s with the high priority health conditions, that the benefit of AstraZeneca is still very clear when compared to not being vaccinated. So we do want to provide a bit of flexibility to our clinician partners to assess when there may not be a better option for people, but by and large, the AstraZeneca doses that we have now are going to be reserved for dose 2 because we have such a robust supply of mRNA coming in, and we are able to offer it now to all Manitobans over 18.
Thank you. Maybe the next question is for Mr. Botha. When I look at the projection you showed us this morning, I see kind of a slowdown at the end of the month and the beginning of June, and I'm just wondering why we have less doses administered at this time when we open to more people.
So I don't think there's a slowdown. What we are seeing, I think there's a bump in the middle where we have a confirmed shipment of Moderna coming in the week of May 17th. It'll likely only arrive near the end of that week. So because it's a confirmed shipment delivery, we're scheduling and planning for that Moderna. So you sort of have the bump in the middle of the doses administered forecast. There's no other confirmed shipments from Moderna after that point. So then after that point, we're sort of back to our usual Pfizer projection. So maybe that's why it looks like a bit of a dip. But the federal projections are showing that we should be getting more Moderna after this shipment, so in alignment with our second dose plans. So in reality, I think what we hoped for soon from the federal government is a confirmed shipment after this Moderna one, which will see a continuing increase in that doses to be administered forecast model.
From CBC Manitoba, Bart. From CBC Manitoba, Bart.
Hi there, can you hear me now?
Yes, please proceed.
All right. Dr. Reimer, a little bit of a qualitative one for you here on AstraZeneca. People who got those doses, there was a jump around and a bit with the eligibility. Then there was a lot of confusing, contradictory information between NACI and some federal politicians, and even folks such as yourself on its efficacy and safety. Now, AZ users are about to wait a few more months, maybe, to get that second dose. So just what message do you have for those people who've got that first AZ dose in their arm?
Yeah, AstraZeneca has had a bit of a bumpy road in their rollout, which has been unfortunate. And I know that Manitobans have seen different advice coming from different players at the national level, globally, in Europe, and at the provincial level. And our message has been consistent throughout and remains consistent, that AstraZeneca offered protection to Manitobans at a time when we didn't have mRNA, so Pfizer and Moderna, to offer to everyone. So what our job in public health in Manitoba is to look at the risk related to COVID infections and look at what we have available as far as vaccines and make decisions about how to use those in the best and safest way possible. So we analyzed the cases of COVID that we were seeing in Manitoba and the risk that Manitobans had of ending up in the hospital, ending up in the ICU, or dying related to COVID. And then looked at the risk of these rare blood clots with low platelets that were appearing with AstraZeneca, somewhere around 1 per 100,000 doses. And it was very clear that for those who were over 40 or who were younger with health conditions, that the benefits of receiving the AstraZeneca vaccine and preventing those serious COVID outcomes were much, much greater than the risks of choosing not to get the vaccine and being at risk of those severe COVID outcomes. And so for Manitobans who chose to receive the AstraZeneca vaccine, they did a good thing for themselves, for their families, by being protected as early as possible. So, it's entirely possible that some of those 75,000 people have been exposed to the virus over the last 2 months, and some of them were not infected because they took that AstraZeneca vaccine. And so despite the fact that there is this low risk of blood clots, we still needed to use it as a tool to protect Manitobans as quickly as possible. Now that our supply of mRNA is great enough that we can offer it to all adults in Manitoba, we need to shift our thinking a little bit because we haven't seen those blood clots related to Pfizer or Moderna. And so we want to continue the rollout the best possible way that we can, but that doesn't take away from the good decision that Manitobans who took that first dose of AstraZeneca made at the time, because the alternative for them was waiting longer and potentially being exposed to the virus. So we're right now trying to figure out how we're going to manage dose 2. But I do want to reassure everyone who received AstraZeneca that you will not be left out of our dose 2 rollout. We're trying to wait as long as possible because we're really hoping to get that one study that's going to show us some evidence about mixing vaccines to help inform our final decision. But in no way will we ask Manitobans who received AstraZeneca to wait longer than necessary if that study doesn't come out quick enough. So we will make decisions based on evidence from other vaccines, from immunology more generally, to ensure that all Manitobans are offered a second dose. But we are trying to wait as long as we can so that we can have that science on the current vaccines backing whatever decision we have, if possible.
Thank you very much for that. To Mr. Botha or either of you, the Moderna trial with the distributed model right now, how soon are you from being able to give Moderna in large quantities to doctors or pharmacists?
So I can take the first answer and then pivot to Dr. Reimer. So the pilot's going very well. It's not a massive one. It's a 2,300 Moderna sent to partners within the distributed channel. The goal was to have them all administered within a week. We're well on our way to do that. And the lessons learned look promising. Now, there remain one tool in the toolkit, especially as we get into second doses. So we're actively looking at, with a more robust Moderna supply. Moderna's been great for our pop-ups. We're now pumping it through a super site as well at Lila. But the supply, by all accounts, will be robust. So what is the right balance to send Moderna through channels, the various channels that we have, knowing that we want to get doses in arms as quickly as possible, and we know our pop-ups now are pretty good at doing that. Our super sites are very good at doing that. But also having access not be a barrier to Manitobans. And I know that from our medical team, the wide reach that physicians and that pharmacists have, both in terms of location but also knowing their patients, makes this very attractive in terms of sending out vaccine. So we're actively looking at it. I don't think there is an operational limitation to doing it. These partners have shown they're quite capable at administering these vaccines thus far in the pilot. Our distribution ability out to send a vaccine to hundreds of locations across the province has been sort of tried and true now with the amount of AstraZeneca we've already done this with. We just have to find the right balance between access and speed. The speed is still sort of the thing we're looking at, and as fast as these partners can be, our super sites are very fast too. So I don't know if you want to flesh any of that out, Dr. Reimer, or is that covers it?
Yeah, we haven't had a chance to meet with the partners who were part of the pilot yet. I know that they have a lot of lessons learned that they want to share with us that would inform our future planning. So until we've had that conversation with them, we don't want to make any assumptions about what worked well and what the challenges were and how we'll move forward, because we really do want to listen to their experience to guide those decisions. So we haven't made any final decisions, but we hope to meet with them in the very near future to understand how the pilot went from their end.
From the Canadian Press, Steve.
Oh, hi there. I know the federal government has given you a heads up that more AstraZeneca is coming in, and you mentioned that. Is it, at this point, is it a confirmed shipment, and do we know how much and when?
So we do have a signal from the federal government that around next week we have an allocation that could be a confirmed shipment of around 23,000. But as Dr. Reimer has said, the medical strategy now is to ensure that we hold those for second doses. The second doses, given the first dose that was received from AstraZeneca isn't imminent for next week. So we'll protect that allocation. Anything else on that, Dr. Reimer?
Nope, I think that's good.
Okay.
Thanks. And you've mentioned throughout this campaign that theoretically there's a capacity to administer 20,000 doses a day. That's 140,000 doses a week. And looking back, we're still ramping up and still not near that much in terms of the doses coming in. Do you foresee during the second dose campaign a time when we are getting 140,000 doses a week into the province and putting that much into arms?
So there's a couple of things there. It's a combination of supply, capacity, and uptake. In terms of the supply, we've run the modeling. I don't have the specific dates on me at the moment, Steve. We've run the modeling in a high supply scenario. There's I believe around 3 weeks where we do see that amount. That will come in. Now with our extra tranche of super sites, having two, and really with 2 floors in Winnipeg, 3 in Winnipeg, but then 2 in each of the other regions, we would be able to pump that out if indeed that unfolded, that we did get that amount as that projection shows. The rest of those weeks, though, outside of those 3 in the high supply scenario for the second dose campaign, we are not getting that much in per week between Moderna and Pfizer. So we won't be able to stress test quite at that level consistently. But then the other piece there too is, of course, uptake. We can have all the supply in the world and all the capacity in the world, but we need Manitobans to book and get the dose in there.
From CTV Winnipeg, Michelle.
Hi, this question is for Dr. Reimer. Is there any evidence of this low platelet blood clot condition in AstraZeneca's second doses specifically?
So we have heard from our European counterparts that they have seen some cases in the second dose, but it does appear to be occurring a lot less frequently after dose 2 compared to dose 1. We don't have very strong data on this yet because most countries are so early on in their second dose rollouts. So all I can say is that the early data is more reassuring regarding second doses than first, but that it is still possible to occur after a second dose.
Okay, thank you. With the priority health conditions list, is this a final list or will more potentially be added to it if there's evidence for that?
So the list that we'll post today is the final list for who will be able to book dose 2 before we start the general dose 2 rollout. The list was created by our medical advisory table, which has specialist physicians from many different specialties who all reviewed their own areas of expertise and provided us with guidance on what conditions they were concerned might make somebody less likely to be immune after only one dose. Because the dose 2 rollout is going to happen very quickly, there won't be any opportunity to do any further follow-up to see how people respond to dose 2 as we're doing it, and really all Manitobans will be eligible so quickly for dose 2 that we don't anticipate making any changes to that priority list, and instead we'll be going quickly into our timing-based approach for dose 2.
From CityNews, Alex.
Good afternoon. Thank you for the time. May have missed this here, so I apologize if I did. But will your predictions for immunization be backlogged due to the AstraZeneca stuff, or are you guys confident with your predictions moving forward?
No, the clinical decisions on AstraZeneca will not impact our overall timelines at all. So we will be able to complete the first dose campaign by early June, start booking second doses no later than May 22nd, and be done second doses by mid and July. There's no impact. AstraZeneca is a very small sliver of the overall campaign, so there's that piece to it. And really, this is about clinical guidance on how to use it. We will get through Manitobans at the exact same rate, regardless of what the decisions on AstraZeneca are.
Perfect. Thank you for clarifying. And I know our focus today has been on AstraZeneca, but wondering if you guys have heard anything with Johnson & Johnson. Is there any update on that?
We have not heard anything. So Health Canada is continuing to review the data. I believe that they were expecting to receive data this week, and some information that they were expecting from the US, but we have not been given any indication of when they'll complete that review, and when or if they'll be releasing those doses to the provinces.
From CHVN, Taylor.
Hi, good afternoon. What is the percentage of people who have already gotten the first dose do you expect to get a second dose?
Sorry, can you say that one more time?
When people get the first dose, how many of that population are you expecting to get a second dose of the vaccine?
Well, we certainly would like that to be 100%. We know that the first dose is very effective and does protect people, 80% of the time. But you don't know if you're part of the 20% who didn't mount a strong immune response after dose 1. And some small proportion of those 20% will see a better immune response after dose 2. And for everyone, we know that dose 2 will provide longer lasting immunity. because we really don't want to repeat October and November from last year again this year. We'd really like to have Manitobans protected across the board at that time of the year when we know that there's higher risks of respiratory viruses circulating. So, you know, we know that we'll never hit 100%, but our goal is to get as close as we possibly can to having 100% of people who received the first dose get their second dose.
Thanks. And you said you're not booking second doses yet, but we have recently been seeing some Manitobans who aren't healthcare workers getting that second dose. Can you just explain when you started doing this, which groups were selected to get their second dose, and how many second doses have been given?
So broadly speaking, we are not booking any second doses. We do have a very small alternate schedule process that we developed with some of our specialists in rheumatology, oncology, and immunology, because there are some individuals who, because of treatment that they're going to be receiving, they need a specific timing of their first and second dose. So for example, there's some people who need to receive their dose before they get a treatment that is going to make it so their immune system can't respond to a vaccine at all. And so it's critical for them to get that second dose of the vaccine before their immune system is no longer functional. And so we do have this small process where the specialist physicians can refer in people who have treatments upcoming that will impact their immune system through our booking center, but it is a separate process. And I don't have the exact numbers, but we would be talking about, you know, tens and to hundreds of people, quite negligible compared to the overall doses that we're giving every day.
Our final reporter this afternoon from CBC National News, Cameron.
Hi, good afternoon. Just to follow up on AZ and Steve at the Canadian Press's questions. On the supply of AZ, so when we're talking about that second dose and holding those shots back, between what we have on hand right now and what we know to be getting, are there enough doses there, or would that still require some unknown quantity to come into the province that we don't have an assurance on just yet?
It would. Oh, sorry, Cameron. It would require some unknown quantity to still come in. So there's about 7,000 in the province now. There's about 23,000 allocated to us in this future shipment that's in Canada. So, you know, there is another amount if the clinical direction to the operations side was that you needed only AstraZeneca for the second dose, for those who had AstraZeneca for the first dose. There is another amount that would have to come in, and the supply chain is, as we've seen, a bit more volatile for AstraZeneca, especially given the export ban in India.
Yeah, I just want to add to that, though, just to reassure people who received AstraZeneca that regardless of what happens, you will be offered another dose of a vaccine. So, you know, if we get no further doses of AstraZeneca, some may be offered AstraZeneca, but if we don't have enough, we will offer mRNA vaccines to those who can't get AstraZeneca. There's the other possibility that we have enough AstraZeneca and the studies show us that sticking with the same product is beneficial, in which case you will all be offered AstraZeneca because we want you to have the best possible coverage if that's what the study shows us. And then the third option is that the study shows us that it either doesn't matter or there's a benefit to switching products. And in that case, we will be offering mRNA to people who received AstraZeneca for their first dose. But in all three scenarios, regardless of what we have on hand and what that study shows, we will be offering a second dose to everyone who received the AstraZeneca vaccine.
And Doctor, just to follow up on that, you know, there's about 84,000 people that had that vaccine, and you had mentioned before AstraZeneca is getting a bumpy ride, right? The reputation of the vaccine is getting a bumpy ride. To be clear, is the decision in Manitoba right now based more on supply, or is it based on clinical concerns?
Our concern, our decision is based on both. We stand by the same statement that we've made previously, that compared to waiting for the mRNA vaccines and compared to not being vaccinated, it is very clear that people over 40 should receive the AstraZeneca vaccine because it's going to prevent more bad outcomes than it's going to cause by quite a large margin. And that remains true today. The difference today is that we have a large supply of mRNA coming and we've made all adults eligible for it. So there's no change in our clinical guidance. We remain confident that AstraZeneca is a safe and effective vaccine. But now that we have this great supply coming in of Pfizer and Moderna, we want to look to the supply issues of AstraZeneca and make sure that we are saving as much as possible given the uncertainties we have around the export of vaccine coming out of India. So it really is a combination of the clinical guidance we've had throughout, as soon as we learned about these blood clots with low platelets, but also with the uncertainty we've seen with exports coming from India.
Thank you.
Thanks, everyone. That concludes our media briefing.